Today, I want to talk to you about canal preparation, and specifically, I'd like to talk to you about those instances when you have an irregular glide path. When we have an irregular glide path, like in this simulated plastic block, you can see that we have probably a couple choices. In some cases, we can negotiate apical to the block, and we might be able then to shape that and completely buff out or eliminate a small ledge. In other instances, when the ledge is fairly significant, we'll determine that there's a ledge clinically, but we may not be able to eliminate that ledge following negotiation and shaping procedures. So I'd like to talk to you about canal preparation in the instances where we do not have a smooth, reproducible glide path. I would recommend that the colleague go back and look at the other shows that I've previously done on canal shaping and what we do to get a regular glide path and what we do when there's an irregular glide path. We're focusing now on negotiating apical to this large ledge. This ledge could be iatrogenic in etiology, or it could be actually pathologic, like in the instance of a resorptive defect. I'm working small-sized hand files that are pre-curved, carrying them through a pre-enlarged canal, and with some determination and desire and sufficient time, I can begin to work 10s and 15s apical to the impediment. If you need more shape, simply use a rotary shaping file coronal to the ledge to give you a little bit more working width. Sometimes a greater working width allows you to take a pre-curved file and pass it through a pre-enlarged canal so that when you get to the impediment you can more readily bypass it. Here we are using the orthodontic bird beak plier to pre-curve ProTaper and to convert ProTaper into a manual instrument. The motion, once you've bypassed the ledge, is just a rotary motion, like the motor would drive the file if it was mechanical, so the operator manually simulates pretty much the motion that the motor would place on the file. The S2 or Shaper 2 from the ProTaper family is pre-curved. Again, the whole trick is to get the instrument into the secured part of the canal apical to the ledge. In this case, we work the ProTaper S2 until we reach length. Notice that we are expanding the shape, and as we expand the shape, we're minimizing the ledge, but the ledge is still present, and it's still an impediment to sliding smoothly through the canal to the terminus. We must irrigate frequently during these procedures as we're generating debris. Here's the ProTaper Finisher F1. It's a 2007, so its tip diameter is 0.2 of a millimeter, and its apical 1/3 taper is 7%. And here we are using the first finisher to again reduce the ledge further and to prepare the apical 1/3 of the canal. Once the F1 has been carried to length, we have a wonderful shape in the apical third. It would be needless to over-prepare the foramen just to try to remove the ledge. So in some instances, if in fact we can confirm that the foramen is 0.2 of a millimeter, then we can trim a cone to 0.2 of a millimeter. You can use scissors or a gutta gauge, or you can compare the apical part of the cone to the file that was snug at length, and you can take this cone and pre-curve it and slide it through to length. A helpful hint is to dip the pre-curved cone in a dappen dish of 70% isopropyl alcohol. By dipping the cone in alcohol, you can make the tip of the cone much more rigid, which is a big advantage when sliding the cone through the coronal 2/3, and it will help you bypass the ledge without the cone rolling over and creating an upset. I hope you've had a good learning session on how to shape those canals that have an irregular glide path. Certainly, not all the discoveries have been discussed today, and certainly there will be more to learn, but this should get you started. Best wishes in ledge management.